If you've sprained your ankle, you might not be sure what to do because there's a lot of differing opinions on topics such as ice versus heat, rest versus movement, and what exercises you should be doing. In this video, I'm going to take you through our approach and the rationale behind our approach and some research so you have the best information possible to heal your ankle sprain as quickly as you can and get back to doing the active things you love. Coach E from Precision Movement here, and welcome to our first video of 2024. We're on the precipice of reaching a pretty big milestone when it comes to YouTube, which is 500,000 subscribers, and we'll probably hit that in the next month or so. So to everybody who has hit the subscribe button and follows us, thank you for helping us to reach such a big and cool milestone. So today I'm going to be talking to you about ankle sprains, and because I've been playing a lot more tennis lately and been playing a little bit more competitively, I've been experiencing some instances on the court where I feel my ankle just like it could have rolled over a little bit. So the type of ankle sprains we're talking about are known as inversion ankle sprains. That's where your ankle rolls that way, so the bottom of your foot points inside, and you damage the ligaments and tendons on the outside of the ankle. These are the most common types of ankle sprains, so that's where we're going to focus. And they happen in sports where there's a lot of lateral movement, like tennis, like soccer, like basketball, but can also happen in everyday life. For example, if you're walking down the curb and you slip off the curb, you can roll your ankle that way. Or if you're hiking and you step on a little twig or branch that's on the ground, you can roll your ankle like that. So there are a lot of different ways that you could sprain your ankle. And nowadays, especially with YouTube and the internet, there are a lot of different opinions as to what you should be doing when it comes to rehabbing an acute ankle sprain, as well as rehabbing and progressing back to your sport or your everyday life pain-free. So we're going to get right into it, and we're going to start right here. Ice versus heat. There's a lot of controversy on this topic. So right now, there's some opinions saying you shouldn't use ice at all. And we differ from that for two reasons. Number one, is ice is a very good analgesic or pain reliever. So if you're in so much pain where you need some kind of relief, then ice is going to be really, really helpful. And this can help you to avoid something like Tylenol 3 or opioids. In the grand scheme of things, ice is a lot less risky than taking opioids. So if you're in need of acute, immediate pain relief, ice is really beneficial there. Number two, the point that often gets missed from the anti-ice crowd is that if you've severely ruptured ligaments or tendons with your ankle sprain, then there can be a lot of bleeding going on. And ice can stop that bleeding from happening so you don't get as much swelling as if you just left it, or what some people recommend, which is to start using heat right away. That could increase the blood flow and increase the amount of swelling you get into the joint, which is not good. That's going to limit your movement and that's going to delay your recovery. So ice within that context can be a really beneficial tool to use, and it's one that we highly recommend. Now, when it comes to how to use ice, use it right away for that pain relief. Once you've got the pain to a manageable level, you can stop icing. And definitely don't go beyond 48 hours where you're applying ice. Within 48 hours, that's fine if you need a little bit of pain relief. But after that, what we can do is we can use contrast therapy. This is one of our favorite methods for pain relief through the rehab journey. Alternate between cold, 30 seconds, as cold as possible. You can use an ice pack or do it in the shower, and then alternate that with hot as possible for 30 seconds. Do that 3 to 5 times, and you're gonna get the best of both worlds. You're gonna get the pain relief from the ice, and you're gonna get the increased blood flow from the heat. So that's what we think is our rational, logical, and science-based approach to the question of whether you should use ice or heat. Now let's talk about the second point here, RICE versus police. RICE has been around for decades. That stands for rest, ice, compression, and elevation. And police is a newer acronym, and that stands for protection, optimal loading, ice, compression, and elevation. Now, elevation is not something that I do a lot of personally. I don't typically recommend it, but if you want to do it, sure, it's not going to hurt you. But if you employ the other methods that we're talking about here, it's kind of unnecessary. Compression, this goes along with the P in my mind right here. So P, that stands for protection. Basically, you want to protect that injured joint from getting re-injured. So if you have to throw a wrap on there, a compression sleeve, a cast, that's beneficial, especially if you have to go out and do something where there are some uncontrolled movements or more dynamic movements. But basically, when it comes to P and protection, don't do anything stupid to re-injure yourself. And when you're doing things and you're doing specific movements, work within your pain-free or the limits of pain tolerance, not excessive pain, the limits of pain tolerance for whatever movements you're doing. So P is protection, and I also think of pain when it comes to the P there. Now the key point here that I want to focus on is the OL versus the R, because we already talked about the role of ice and heat. When it comes to rest versus movement, it's really clear now that from studies and research across all different joints, not just the ankles, that movement is more beneficial than rest when it comes to rehabbing injuries. I found a study titled Comparison of the Effects of Price and Police Treatment Protocols on Ankle Function in Patients with Ankle Sprain. And this was a randomized controlled trial with over 100 subjects, and it directly compares the acronyms we're talking about. The researchers found that police was superior at 3, 7, and 14 days post-injury versus price in both pain and functional outcomes. The movement guidelines that the researchers gave to the subjects in this study were to move the ankle in the 4 different ranges of motion, so plantar flexion, dorsiflexion, inversion, and eversion, and also to move around, so go walking, as long as it was within the limits of reasonable amount of pain. Getting movement as quickly as possible is great because that brings blood flow. It keeps the muscles awake and activated because when there's injuries, the brain shuts down muscles to prevent further injury from happening. But as long as you're working within a pain-free range of motion and not overstressing the inversion movement, because that's the mechanism of injury. So if you're really pushing that movement, then that can limit and cause increased tearing of the already torn tissues, then you're good to go. Get it moving and get it moving as much as possible and activate all of the muscles around the ankle joint. So with that background out of the way, now you understand how to use ice, how to use heat, and you can just kind of ignore all the noise around ice is bad for you or heat is the holy grail. You know about these new acronyms, police, RICE, and also price is also a new acronym. They just added the protection onto RICE. So now you understand these acronyms if you hear them being spoken about. And now we're going to get into the exercises. So I'm going to take you through some acute rehab exercises in that initial phase, and also some prevention and performance exercises that are a little bit different compared to if you search for ankle sprain exercises here on YouTube. You'll see some things in the exercise that I'm going to show you that are missing from other videos. Now it's time to move and restore your foundation for pain-free movement and do some exercises for prevention and performance. But before we get to that, really quick recap of the acute 24 to 48 hour phase. Start off with ice to stop the bleeding, literally, and prevent excessive swelling from developing in the joint, and to decrease pain. And as soon as you can, move to contrast therapy, where you're doing 30 seconds as cold as possible, alternated with 30 seconds as hot as possible, done 3 to 5 times. Then you do some basic ankle movements. You can start off just moving it back and forth, plantar flexion, dorsiflexion, holding for 5 seconds within pain-free limits. And then you can move to inversion and eversion. So that's inversion, that's eversion. Be careful with the inversion. Holding it for 5 seconds, you're moving it around 2 to 3 times in each direction, and do that throughout the day. The more movement you can do without any pain, the better. And most importantly, don't re-injure yourself. Don't do anything stupid. When it's time to get to the exercises, the first concept I want to teach you that's going to persist throughout all of the different exercises we're going to do today is the concept of the short and skinny foot. That's to get the muscles in the bottom of the foot, the intrinsic foot muscles, activated and strong. And the reason why you want to activate these muscles is because, one, they're sleepy in most people because we stuff our feet into foot coffins for most of the day. And number 2, the benefits that they provide are proprioceptive in nature. So they tell your brain how to handle the terrain that you're walking on, and they help you to improve your reflexive ability time, so your ability to respond to sudden or unexpected movements, whether that's in sport or if you're on a hike and you step on a rock. So those muscles are very important. Now, I'm not going to cover it in depth. Really quickly here, short and skinny foot refers to making the foot short, so pulling the forefoot towards the heel and making the foot skinny across the top here. So you could start off, you can spread the toes out, this can help. And then you pull in, make it short and make it skinny. And you hold that for, it can be 10 seconds. Now, if you have no idea about how to do this or you can't feel anything going on, check out the video. We're going to link it up here and in the description down below, where Dr. B goes through a remedial little set of exercises to wake those muscles up. Now, once you can get those muscles going, or you could just follow along and do the next exercise with me because it'll still be beneficial. The next exercise is called the 4-way MTP Slide. MTP stands for metatarsal pressure. The metatarsals are found right underneath the forefoot here. And we want to apply some pressure there and get the intrinsic foot muscles working in all of the ranges of motion of the foot and the ankle. So this is how the exercise goes. You sit down on a stable surface, good posture, get that short and skinny foot if you can, and then you're simply going to slide in 4 directions, maintaining the short and skinny foot. Now my foot's a little sweaty, so I can't slide as well on the mat here, but I would normally do it with a sock on this hardwood floor. Hold it for 5 seconds at the end range, going forwards, and then slide it, maintaining the short and skinny foot, holding for 5 seconds, pulling the foot towards you, underneath you, and then going to neutral, 90 degrees at the ankle, and we're going to go out to the side here, and this is inversion. So this is really beneficial for starting to strengthen this vulnerable range where you got injured. Hold it for 5 seconds there, and then you're sliding it to the inside, keeping the metatarsal pressure across all 5, underneath all 5 toes there. Foot stays pointing straight ahead, a little bit of weight's down on the foot, and then you return to neutral. So you go 4 directions, holding for 5 seconds in each direction, maintaining the short and skinny foot, so the intrinsic muscle activation and the metatarsal pressure, and maintaining that throughout the movements, not just at the end, but as you're sliding in and out. The other benefit here is that we're going to start to wake up the muscles of the hip, the internal, the external rotators, the adductors, the abductors, and that's, as we're going to talk about with ladder exercises, is also very important for preventing ankle sprains. Now we're going to move to the midline rotation exercise. And this exercise is going to wake up the deep stabilizer muscles of the hip, which are really important for preventing this movement that predisposes you to lateral ankle sprain injuries, and integrate these muscles from the feet, the intrinsic foot muscles, right up the midline of the leg and the thigh here. So the tibialis posterior and the adductors are going to get integrated into this movement pattern. For this, you need some type of band to wrap around and place just above your knee. So I've got a strength band here. You can use these types of rubber bands. You just clip them and tie them to a door handle or heavy table leg or something like that. You got to be creative with this stuff. Then we just need a little bit of tension. That's pulling the knee out this way. So to counter that, I'm going to get my leg in alignment so it's straight from my hip down to my knee, down to my foot, and I've got my short and skinny foot going, the intrinsic foot muscle action going. From here, I'm on one leg, and you'll feel that right from the feet, right up the midline of the leg. You'll feel those muscles activate. Now we're going to rotate, and I'm going to rotate through the hip. I'm thinking of rotating my pelvis. My foot stays planted, my leg stays pointing straight, and I'm holding for 5 seconds, trying to keep rotating and get further, even though I'm at the end range of motion. So that's going to wake up the muscles on the outer hip here. You'll feel that, as well as all the midline stuff in the feet. And then I'm going to slowly rotate and do internal rotation, rotating my pelvis this way. Same thing, keeping good alignment, keeping the short and skinny foot going. The foot is flat on the ground, and I'm actively trying to get deeper into internal rotation there. So holding for 5 to 10 seconds at the end range. Keep your good alignment, keep your posture, keep breathing naturally. foot intrinsic muscles stay on. You'll feel if you lose the foot intrinsics, it's much easier to lose balance. Internal rotation, turning the pelvis this way. You'll feel all these muscles through the hip, down through the inner thigh, through the shin, and right down to your foot. Really important exercise, and one that we've come up with, so you might not find it elsewhere, but trains such important concepts as it relates to ankle sprains. Now that we've woken up the deep hip stabilizer muscles and integrated them with the feet and the entire lower body with the midline rotation, we're going to take that into a movement pattern that is a functional movement pattern, a fundamental movement pattern, which is the squat or lunge movement pattern, and key on a couple points for ankle sprain rehab. So this is the PM one leg wall squat. To start off, you put your shoulder against the wall, stand in good alignment, and your feet are just hip width apart. So I'm set up there. Now I'm going to bring my arm that's closer to the wall forwards, and I want to keep this is going to help me keep my shoulders square with the wall here. I'm going to bring my other leg back. So I'm in hip extension, my knees bent, and down here on this foot, I've got that short and skinny foot going. The foot intrinsics are active. From here, foot stays flat the whole time, and I'm gonna push my shoulder against the wall, squat down, making sure that my knees staying in line with my foot. My thigh is pointing in the same direction as my foot. So I just squat down, get my knee as far forward as possible, keeping the foot flat, and then I'm coming up. Again, I'm going down, foot stays flat, thigh is pointing in the same direction as the foot, squatting down, and then coming up. And the whole time I've got the short and skinny foot, and I'm applying a little pressure into the wall. So I'm pushing myself into the wall a little bit. What this is going to do is work the foot intrinsics with ankle dorsiflexion range of motion. That's the knee traveling in that direction over the foot. It's going to work the hip stabilizers, specifically the hip abductors, and it's going to work that whole lower body alignment, keeping good alignment here. Because if we've got poor alignment, especially if you're in varus knee, most people are in valgus, but varus knee is common too. If you're in varus knee, you're already starting to roll over that ankle. So this is just going to make sure that you stay in good alignment, which is where we want to be. The hip abductors, if we've got the hip shift, so if you stand on one leg and you tend to go like this, look what happens at the ankle. I'm already rolling over top of the ankle there. So I'm predisposing my ankle to injury if I have that dysfunctional movement pattern. This exercise counters that dysfunctional movement pattern. The previous exercises worked on what we call is your foundation for pain-free movement. They activate muscles that are often sleepy in the feet and in the hips. They work your alignment, so making sure you have good alignment, you're not doing anything dysfunctional that's going to predispose you to an ankle sprain. And they work your active range of motion in fundamental movement patterns. These are movement patterns that transfer well to everyday life, sport, and the gym. Now we're going to go through a couple of prevention and performance exercises. And these work what we call the performance pyramid. They get you up that pyramid so that when you're on the top of the pyramid, you're performing optimally for whatever activity you're doing or sport you're doing. And at the same time, they help you to prevent injury. The first exercise we're going to do is the Crossunder reverse lunge. Now, the reverse lunge is one of my favorite exercises for lower body strength. The Crossunder lunge is specifically for those with ankle sprains or for those who want to prevent ankle sprains. Here's how it looks. Let me show you first. You go really slowly. Pay close attention to what's happening at the foot and the ankle. That's what it looks like. So what are we doing here? By putting force over top of the outside of the ankle here, this is the mechanism of an inversion ankle sprain. You roll the ankle that way. After the initial phase of rehab and the foundation, this could be anywhere from, depending on the severity of the ankle sprain, anywhere from, I would give it 30 is cutting it a little close, maybe a really mild grade 1 sprain, but 60 to 90 days after the initial sprain, you start to do techniques like this. what we're doing is we're loading the tissues that were damaged, and by loading them in the exact movement where the damage occurred, we're going to strengthen them. They're going to get stronger, but instead of just doing a normal reverse lunge, or if you're just doing a squat or a deadlift or any of the exercises we typically do, this exercise, because it's nice and controlled and slow, is going to build you up to the point where you need that in sport where you're running faster. So you start with an exercise like this to get that strength in the tissue, and that's how you build resilience. So the keys here are to go really slowly, so you're controlled. You can even use sticks on the ground or hold on to something to give you a little bit more support, and start that way. And you just load the outside of your ankle and bring yourself back up. Nice and slow and under control. Now, I would start off really lightly. 2 sets with 2 minutes rest in between, and just doing 2 or 3 or 4 reps to start off, and progressively build yourself up. You can do this twice a week and progressively build up over a period of 6 to 8 weeks. Because when you train tissues, like we're hitting ligaments here, we're training ligaments, they respond a lot slower than muscles do. So we're training those ligaments and tendons, and that's going to help those tissues get stronger to prevent ankle sprains from happening in the future. The last exercise I'm going to share with you today is again to be done later on in your rehab journey. It's called the one-leg lateral hop and stick. And this is going to further ascend you up the performance pyramid so that we're working speed and agility and power. Because when we don't train these things and then we need them in our everyday life or sport and we haven't trained them, we don't have it. And that's when injuries can occur. So this exercise, even if you're not an athlete, this is for you to work up towards. Start off on one leg. So I'm loading up this leg, making sure I'm in good alignment. So I'm starting from a good place. And here I'm gonna load it up. I'm just gonna hop over, catch it, and try and hold it. Good alignment. Thigh is pointing in the same direction as the foot, which is straight ahead. Good posture. From here, load it, catch it, and try to stick it. So when you try to stick it, you're holding that, you're working that balance and that stability through the lower body, as opposed to just going side to side quickly. So hopping, you see on my right side, I'm a little bit less balanced. Hopping side to side. And start off, don't do massive hops, max jumps. Just get that lateral force, which is where you need to stabilize, because that's where the injury occurred, in the lateral or frontal plane of motion. You're just going side to side, thinking of your balance, sticking it, restoring your balance and your alignment before moving on. So you're not doing this kind of thing. This is easy because I'm just using momentum. What's harder is to hop over and stick it. And the farther you go, the harder it's going to be to stick. This exercise you can do, once you built up to this point, do more sets. Do 4 to 6 sets, 6 to 8 repetitions per, and that's going to build up your power, your speed, your agility, and also your ability to repeat this movement pattern over and over. That's good balance, good alignment, and that's going to give you the best chance to stay injury-free. So these exercises are just a sample of our approach. Our overall approach could include many, many more exercises than this, but I just wanted to give you some of the elements that I see are missing from a lot of the other videos and content that you'll find on ankle sprain rehab. This is how you go from injured and painful up into injury-free, performing well, and minimizing your risk of future injury. So if you like that video, let us know. Hit subscribe. You know what to do. I don't have to tell you what to do. But we've got a couple other pieces of content that go along with what I've talked about here. First is the intrinsic foot muscle video with Dr. B. Second is the hip abductors. That's going to keep your hips in balance. And third, if you want a step-by-step program with all of the exercises laid out and all the reps and sets and progression, check out the lower limb control course right here. And that's going to help you to not only deal with ankle sprains, but anything that's going on with the lower body, and going to help you to get back to doing the things you love to do.